It's a beautiful day. The sky is blue, dotted with fluffy white clouds blowing in the wind. You wake up and happily admire through your window the snow lying on the roofs, the streetlights, the sidewalks, the beams along the sidewalks. And of course, you get distracted and fall. Almost immediately you understand something is wrong with your knee. A few hours later, you are in the emergency room, with doctors around you speculating on your injury and waiting for the X-ray to confirm their hypothesis. Once the results are released, the picture seems clear. The final diagnosis is a torn meniscus and a broken cruciate. Hold on. If I were you, I would have a look at the anatomy of the knee. So once again, you have torn one of the little cushions under the kneecap and one of the 4 ligaments around it. Now it's clear, right? So, you may ask, for sure you need surgery, but this is not the reason why I'm telling you the story. What is rational to do at this point? What would you do? I bet that you, as many of the US patients, would ask for a second medical opinion. As a matter of fact, according to a 2017 Mayo Clinic study, second opinions cut down the rate of diagnostic errors from 50 to 26%. You trust science. That's why you request an MRI and consult the second orthopedist, the retired father of your childhood best friend. You get the second opinion based on an MRI performed on a swollen, gigantic knee. The anterior cruciate is broken and the medial collateral is severely damaged. Wait, wasn't the meniscus broken according to the other doctor? The second doctor wants to operate immediately on both ligaments. Now, I bet that you would rationally ask for a third opinion, right? Given the contradicting previous ones. According to the same Mayo Clinic study previously mentioned, a third medical opinion drives the percentage of error down to 16%. You trust science and once again listen to the third diagnosis. This time, anterior cruciate broken, medial collateral and lateral collateral damaged. Treatment proposed is more conservative. Surgery will be performed after a few months on the ligaments that haven't healed in the meantime. So, to sum up, you rationally consulted 3 distinct orthopedists to increase the probability that at least one of the 3 diagnoses is correct. However, along with the probability that at least one of the 3 diagnoses is correct, also the probability of receiving a completely different diagnosis from a different doctor rose. In 2017, a study showed that 21% of patients who sought a second opinion at the Mayo Clinic left with a completely new diagnosis. And in 66% of the total cases, the first opinion was deemed partially correct, but redefined by the second doctor. And this was just one of the numerous studies supporting this thesis. So, the question is, who do you trust? What's your decision rule to select your one surgeon? You've consulted 3 different orthopedists who provided 3 different diagnoses and 3 different treatment approaches. In doing so, the probability that you have heard at least once the true cause and the true answer to your knee problem is considerably high. But how, with your limited competencies on the subject matter, do you disentangle true from false information? From a probabilistic point of view, the optimal number of medical opinions is the number of doctors on earth. This would imply that the probability of being told the correct diagnosis tends to 1. However, assuming no time, no budget constraints, would it be really rational to be overloaded with so much data? Do you truly believe that obtaining a 4th, 5th, 6th medical opinions will help you make a more informed decision, that you will be more knowledgeable and not just more confused. Hearing a few medical opinions is for sure necessary, but navigating too many conflicting medical opinions can be overwhelming and not beneficial at all at the end of the day. This is an untold truth. Information is power, but to which extent in our incompetent hands is information truly power?